Okay, good morning everyone. I am Jenny Anbalang and I will be performing administering a tube feeding. Okay, so first that we are going to do is to introduce self to the client and verified client's identity. Okay, so hello ma'am. Um, good morning. I am Jenny Anbalang, your nursing student this morning. May I know your name? Okay, then next is explain to the client the procedure and discuss how he or she can participate. Then, gathered appropriate equipment. Then, um, perform hand hygiene and observe other appropriate infection prevention procedures. Then, provide for client's privacy. Close the curtains or close the door. Then, next is assist client to a sitting position in bed or a sitting position in chair. Then, if a sitting position is contraindicated, um, place client slightly elevated, right side lying. Okay, then next is assess tube placement. Okay, assess tube placement. Then, next is assess residual feeding content. Then, next is administering the feeding. Okay, then before administering the feeding, check expiration date feeding, then warm feeding to a room temperature, clean top of feeding container with alcohol before opening if open system was used. Okay, so for feeding bag or open system, okay, so um, first is hang labeled bag from infusion fall around 30 centimeter or 12 inches above um, tube's point of insertion into client. Then clamp, tubing and added formula to bag. Then applied a label with date, time of starting of the feeding, then the initials. Okay, then next is open clamp, run formula through tubing and reclamp tube and regulated drip by adjusting clamp to drop factor on bag if not placed on a pump. Okay, then so that is the feeding bag open system. Okay, so let's proceed to the syringe open system. For the syringe open system, first is remove the plunger from syringe and connected syringe to a pinch or clamp nasogastric tube. Okay, so we will remove the plunger. Like for example, may plunger po dito. Then, um, then remove the plunger. Then, added feeding to the syringe barrel. Okay, then next is permitted feeding to flow in slowly at prescribed rate, then raised or lowered syringe to adjust flow as needed, then pinch or clamp tubing to stop flow for a minute if client is experiencing an uncomfortable. Okay, so like for example, this is the feeding. Okay, then Okay, that is for the syringe open system. Okay, so next is the pre-filled bottle with drip chamber. This is closed system. Okay, so explain lang natin to, then proceed tayo for the continuation of the syringe open system. Then, okay, so for the pre-filled bottle with drip chamber or closed system, um, remove remove the screw on cap from the container and attach administration set with tubing. Okay, then next is close clamp on a tubing, then hang container on intravenous hole about 30 centimeter or 12 inches. Then um, squeeze drip chamber squeeze drip chamber to fill it 1/3 to 1/2 full of its capacity. Then next is open tubing clamp, then run formula through tubing and reclamp the tube. Okay, so next is attach feeding set tubing to feeding tube and regulate the drip rate to deliver feeding over desired length of time or attached to feeding pump. Then, okay, then, um, that is all. Yun yung sa pre-filled bottle with drip chamber. Okay, so, yan yung sa pre-filled bottle. Okay, so let's continue for the syringe open system. If another bottle was not to be hung, immediately flush feeding tube before all formula had run through tubing. Then, first is instilled 50 to 100 ml of water through feeding tube or medication port. Then, added water before feeding solution had drained from neck or of syringe or from tubing and administration set. Okay, then clamp feeding tube before all water was instilled. Then ensure client comfort and safety. Ensured client comfort and safety. Then secured tubing to client's gown again. Then ask client to remain sitting or upright or in a follower's position or in a slightly elevated right lateral position for at least 30 minutes. Then, remove and discarded gloves, then perform hand hygiene. Then, lastly is to dispose all equipment appropriately. Then, documents all relevant data. Okay, so, okay, so that is how to administer a tube feeding. Okay, so that's all